Come in.
Hello.
Good morning.
Good morning. My name's Andres. I'm going to be your nurse. You Miss Santos?
Yes, I am.
Okay. I got a couple things for you today. I have your Lispro.
Lispro? What is that for?
Your Lispro is a fast-acting insulin.
What do you mean by that?
It's going to work well from preventing your blood sugar to go up when we're going to give you meals. Okay? So it's around that time to get your food. What's going to happen, I'm going to give it to you 15 minutes before you eat.
Why is that? Is there a reason why you need to give it 15 minutes before?
Yes, because it's going to lower your blood sugar if it doesn't fit within that time frame. Okay. All right. It's going to work well with long-acting insulin. Its onset is 15 minutes. Its peak is 60 minutes. And its duration is 3 to 5 hours. Okay. So if you feel like your blood sugar is kind of low or you're hypersensitive to the drug, please let us know, okay? And it's going to be, the side effects could be pain, redness, irritation on the site. So if any of those, okay, let us know. Your call light's right here.
Okay, I'll let you know.
Okay, your food should be here in 15 minutes, so we'll give it to you right now.
Thank you.
Thank you.
Hi, Mrs. Covert. My name is Bonnie, and I'm going to be your student nurse today. I've been looking at your chart, and it says that you've been diagnosed with diabetes. So what's going on is your body is supposed to produce insulin, and that's supposed to take the glucose in your cells and put it to work and give you some energy. Unfortunately, you're not making enough insulin.
What kind of insulin do I need?
Well, today I'm actually going to give you an NPH insulin. It's an intermediate acting. What it's going to do is it's going to combine with another insulin to keep you covered throughout the day.
NPH, what does that mean?
NPH is an insulin that's going to last you for half the day or overnight and in between meals. Like I said, it's going to work with another insulin as well. It's going to start working between 2 to 4 hours. It's going to work the best between 4 to 12 hours. And overall, it's going to last 10 to 16 hours.
How many pills do I have to take per day?
Actually, Mrs. Cover, it's going to be an injection in your subcutaneous fat. Don't worry about it. We're going to talk about it, and I'm going to teach you. So it's going to be in your abdomen, your thigh, or your arm, any fatty area. And you're also going to take 0.1 to 0.2 units per kilogram of your weight. And you're going to do that 1 to 2 times a day to control your sugar.
How many types of diabetes are there?
Well, there are 2 types. You have type 2, which is the adult onset type.
How do you know I have type 2?
Well, you have type 2 because you've just developed it in your adult age. You can control it with diet and exercise versus type 1, which is a pediatric onset. That's going to be more developed in childhood.
I understand now why I got diabetes as an adult. Do they have any side effects?
Well, you could experience some side effects from the insulin, such as irritation at the injection site, low blood sugar, and you should also contact your doctor if you have swelling, shortness of breath, leg cramps, an irregular heartbeat, or tingling and numbness.
Wow, this explains a lot. Thank you, but I am a little afraid of needles. Would you make sure you teach me how to do this?
Of course, I'm going to teach you all about injecting your NPH, intermediate acting insulin.
Thank you.
Hi, Holly.
Hi, Brittany. How are you?
I got a patient and he's prescribed a combination insulin and I've never given it before and my instructor told me to come and ask you. He's getting prescribed a combination insulin.
Okay, sure. They're a little bit different. They're used to improve glycemic control in patients with diabetes. So it is a little bit different than the fast-acting or the longer-acting. It is the one we use, Novolog Mix 70/30.
Yeah, that's what he's getting.
Yeah. Do you have any questions regarding like the onset and things like that?
Yeah, I don't really know anything about it. So how is the onset? Is it different than the normal insulin?
A little bit. The onset on the Novolog is 30 to 60 minutes. It peaks at 2 to 12 hours. Duration is 18 to 24 hours. And how about the vials? Have you ever used the vials?
I think they're the standard. They're 100 units, correct?
Correct. 100 units. They come in 10 milliliter vials, and then there's a 3 milliliter vial of the Novolog mix, which has the 70/30 mix in there.
Is there any special adverse effects I should look for after administering this?
Definitely. You can look for signs of hypoglycemia, allergic reactions, a local injection site reaction. Allergic reaction can be the body as well, rash and pruritus. And just a couple of things with the combination is you do not use this product during episodes of hypoglycemia, and you should not use it with patients that have any hypersensitivity towards this product or anything that's similar to it, and it definitely should not be mixed with other insulins.
Okay. Well, thank you so much, Holly. I appreciate it.
welcome.
I'm gonna go see my patient now.
My pleasure.
Hi, Mr. Smith. My name is Jennifer, and I'm going to be your nurse today. The doctor ordered a new kind of insulin for you called Dedamir.
How is that different from the other insulins?
It's a long-lasting form, and it lasts for 24 hours.
And how much am I getting this time?
You're going to be getting 10 units, and then that prescription might change, though, according to how much your body needs.
Any new adverse effects or side effects?
Well, with any insulin, you can have the effect of hypoglycemia, which means that your blood sugar drops too low. But with this one, you could also have swelling in your hands and feet or weight gain. So just let us know if you have any of those issues.
Okay, thank you.
Thank you.
Ms. Rank, your blood glucose is at 200 today. We're gonna have to administer some insulin.
What kind of insulin?
Today we're gonna be administering regular U100 insulin. It's a short-acting insulin.
How much insulin am I gonna get?
Well, it depends on your glucose level, but it's gonna be between 0.5 and 1 unit per kilogram per day in divided doses.
What is short-acting insulin anyway?
Well, short-acting is, the onset is between 30 to 60 minutes, the peak is between 2 and 4 hours, and the full duration is only between 5 and 7 hours.
So I'll be good through lunch then.
Yes, it'll take you through lunch.
Okay. And if I don't start feeling good, what are the adverse effects of this medication?
Well, you have to make sure to always monitor your blood glucose before administering insulin, because if your glucose is low, it could send you into hyperglycemia, which is not a good thing. Also, I need you to let me know if you're experiencing any muscle weakness, cramps, or extreme fatigue, because those are signs of hypokalemia, which can be another adverse effect of insulin.
And am I getting this in an injection?
Yes, you're going to get this as a sub-Q injection.
Just making sure.
Are you ready for your insulin
Yes,
today?
thank you.
Okay.